Good afternoon, everyone. Dr. Felix Cabrera here, wanting to be able to make myself available to the press for any questions regarding changes in the testing and quarantine requirements for travelers. So I'm going to go ahead and do a very brief slideshow here and present a few slides to walk us through this. And then we'll take some questions right after. Okay. So first of all, I just want to mention why this change overall. So first of all, I think the number one priority for us is to be able to get our Guam residents who are abroad back to Guam safely, and to do so in a manner that's also safe for the rest of the island, and to minimize the chances of introducing new COVID-19 cases to the island. The second part, I think, is also for the non-residents who are important for Guam's community, whether they're essential or otherwise, and having them come back, come to Guam safely as well. And then also understanding how the dynamics of testing and quarantine play in that role. So this is not about tourism, travel. That's the topic to be discussed later. So these are basically for all non-tourist traveling. So moving on to my second slide here. So there's been, as you are aware, there's a release with discussing the hotspot countries and how that plays into the role here. So before we get into further, just want to be sure that we define what a hotspot country is. And so basically, taking a look at the data behind each country in terms of the COVID-19 cases that they report. There are a number of different ways you can look at it and think about how much COVID-19 cases are there and how infectious people may be if they're based on active cases. Typically, what people look at is the number of case count, or you look at the cases per 100,000 persons in that country. And if you look at that just by itself, it doesn't really give you the full story because, like, for example, on Guam, we have actually 104 cases per 100,000. The rest of the country is 594 cases per 100,000. But these cases, as I'm sure you're aware, date back to even a few months ago. So these are not representative of active cases. So therefore, they're not representative of the risk of bringing new coronavirus to Guam. So instead, the better proxy to help us understand that and to help define a hotspot country is by understanding what the doubling rate is. So hotspots are defined as countries with COVID-19 case doubling rates that are less than every 30 days. So if you have 50 cases of COVID-19 and it takes you 2 days to get to 100 cases, then that's 2 days that it takes to double. And so as you can see, that's pretty fast spread overall. And so 30 has been a cutoff that we used at this time. It looks to be a decent representation of in separating countries that are hot versus not hot. And as you can see here, that when you look at just cases per 100,000, doesn't necessarily match up with the doubling rate. And this slide here shows the table where it's broken down from domestic arrivals to international arrivals to Guam. And then we put some additional comparisons here. So basically from domestic, there are no areas that have doubling rates less than 30 days. And then on the international side, including our friends in Palau and FSM, that they're, and Taiwan and Japan, that their doubling rates are greater than 30. And the only one that's represented here is Philippines at 25.5 days. This has changed. Even on Friday, this was as low as 19. So it's changing and it evolves. And so actually updating this list is going to be an important part of what we'll be reporting moving forward. And of course, South Korea is another country of origin that lands directly into Guam. And as we can see, their doubling rate is greater than 30. For comparison, Nepal is 6, which is that's a very fast doubling rate. So it's represented here. Brazil has been talked about being the epicenter of the coronavirus and COVID-19 in the world right now, and their doubling rate is 16. This map just illustrates how it looks. The darker and the more red is the hotspot areas, and this can be accessed by anybody at the New York Times website, where they illustrate this. And if you were to hover over each country, you can actually get their doubling rate for that area. And this data overall is comprised of data that's reported by Johns Hopkins University and the World Health Organization, as well as other local governments, as stated here. This slide is meant to kind of break down things overall, because we're more used to looking at domestic arrivals here to Guam and the quarantine requirements for that. But now that we will be seeing more international arrivals, we set it up as a way to look at it as international hotspot arrivals versus domestic and international non-hotspot arrivals, just to ensure that we cover both sides here. So there were discussions about having a test done before you even get on the plane. We wanted to illustrate that that is not going to be a requirement in either situation. There's also discussions about where residency comes into play, whether you're a resident versus a non-resident. And if you're coming from a hotspot area, and right now today that's the Philippines, for example, that it doesn't matter if you're a resident or if you're a non-resident, that everybody is going to end up quarantining at a government of Guam approved quarantine facility. And from domestic and international non-hotspots, if you're a resident, you'll be allowed to do your 14-day quarantine at home, and no testing is going to be required. For non-residents in this situation, we are allowing them to quarantine at their residence or rental lodging for the 14 days if they have a PCR test that is negative within 1 week of arrival. And now this is meant to be a screen, in the sense that you want to ensure that this person is taking the due diligence to at least get this test done before traveling, and that will, in all likelihood, reduce the risk. It doesn't do it 100%, but at least it reduces the risk of allowing them to quarantine more so in the general community area as home or rental lodging, as opposed to what will otherwise be completed in the government of Guam approved quarantine facility. And this last slide is basically just summarizes what we've mentioned in the previous slide, and gives the details that has been in the memo from Department of Public Health and Social Services, as well as the governor's executive order, which follows from that. That's the last of my slides, and I'll go ahead and take some questions here. This won't be a typical press conference fashion, but Janella is going to help as we go around.
Thank you, Dr. Cabrera. We'll begin with KOAM, Nestor Lecanto.
Yes, thanks, Janella. Hi, Dr. Cabrera. I'm wondering why not require tests to board flight?
Yeah, just give me 1 second as I stop sharing here overall. So Nestor, that's a great question, and that's the thing that we've gone back and forth on. And the reality is that when it comes to testing, it's just too dynamic, and there's just too many variables that don't assure us of what are the main outcomes that we're trying to get from testing to begin with. If somebody tests too early, we may not be able to they may actually have coronavirus, but then not be able to it won't show up on the test, but they still could potentially bring it on to Guam. So then making people go through that is the cost versus benefit of that was not something that made sense, at least for now, in terms of how we're doing things. The only thing that's a sure safety net, so to speak, and what has proven to work is quarantine itself. So as you can see in this situation, there is no option to test out of quarantine completely. That is different than our previous policies in the past, and we've made the concession that we needed to rely more on quarantines overall, at least for the next few weeks, as we allow these new international arrivals to come onto Guam.
So, but once they complete the 14-day quarantine, do they still need to test out of that?
No, they don't, because the assumption is that if you've had coronavirus and if did not develop symptoms during that 14-day time period, then there really is no reason to test at that point, because there's just a very, very low chance that you would have it and spread from there. Sorry.
Janella, can I go on, or some?
Oh yeah. We're not limiting to
Yeah,
the
we're
two
not-
question.
Okay.
It's just we'll play it by ear and see how and we'll go around. But we will try and give everybody a chance to ask their own questions.
Okay, I just wanted some more clarification. When you say doubling rates less than 30 days, you're referring to the speed of the spread?
Yes, exactly. Because when we think about that, we think about how the virus is spreading overall in that country, and we're not designating cities within a country, because then I know that gets different. But the only fair way we could do is look at the country as a whole, and that kind of tells us how many. It's a proxy for basically saying how much active disease is there in that area, and thus your risk of bringing it to Guam.
Okay, I'll pass for now, so that my colleagues can get their questions in.
Thank you.
All right, thank you, Nestor. We'll go to PNC next, Kevin Kerrigan.
Good afternoon, Felix. I wanted to ask about the testing over the weekend. Over 300 tests over the weekend, no positive. Given that we've opened back up considerably in the past week or so, and you're monitoring mobility rates versus the positive tests, are we on track for a move to PCOR 3 by July 1st?
Based on our criteria right now and looking at the testing and the case numbers, we definitely are on track. There's no doubt about that. We've even though we've been having these cases here and there, it's still definitely below the threshold of concern for us. So we are. So that, I think, is going to be something that we'll be confident in terms of that criteria. The other part is that looking at the testing overall and how to focus the targeted approach for testing.
And secondly, what's the difference between quarantining in a GovWam facility versus home? In your words, why is it better or more secure to quarantine in a GovWam facility than allowing somebody to spend the 14 days at their home?
I think we all can relate to the facts of human nature, in that when you're home, the likelihood that of compliance with the full quarantine, 14-day quarantine, will likely decrease compared to if you're in a controlled facility and actually having staff in the area to monitor your comings and goings, and then also other people's interactions with you. That's a big difference in a facility versus doing so at home. When you're at home, also we have very little control of who can visit you, even though we part of the quarantine requirements that you minimize that to just your household contacts. So there is a very distinct different level of risk that's taken when we're allowing somebody to quarantine at home. But in the end, this is all a matter of balancing risk versus benefit, and cost versus benefit. And so the cost of also allowing somebody to quarantine at home is much less. It's not zero, because in the end it still takes a significant amount of personnel to help with the check-ins and the monitoring of those who are in home quarantine. But overall it does take less resources compared to as a government facility.
Thank you. And finally, just to be clear, when a returning resident is required to quarantine at a GovWam facility, even if they're coming from a hotspot, GovWam will still pay for that, or does the resident himself have to pay?
Yes, my understanding right now, it is that it will be GovGuam that will be covering that cost, as it is for non-residents. I mean, sorry, for residents. Sorry, yeah.
Thank you, Felix.
Thank you.
Thank you, Kevin. PDN, Anamita Kaur.
Hi, sir. Thank you so far for your presentation. So I just want to clarify, as of today, how many quarantine facilities does the government of Guam have?
I don't have that information in front of me right now in terms of the facilities themselves. And so, and I know there's a difference between the isolation versus quarantine, but I'm not aware of that right now. I'm sorry.
We can get
Okay,
back to you on that, Anamita.
All right, thank you. And then in addition, for residents that are allowed to home quarantine, I understand that there is some amount of supervision that's conducted by public health. Can you describe to us what that looks like? How many, I guess, visits should a resident expect from public health officials?
Yes, and I think I don't have the information off the top of my head, and you know that there are other persons at public health that can answer this question better, like Linda, of course, Denorsi. But the main part of this is that it is a frequent. It is going to be in some way randomized as well. And when I say randomized, it means that by the means that which the check-in will occur, whether by phone or surprise visit to the household, and they are doing that. And so so those who are doing home quarantine can expect that, so that there'll be different modalities in which compliance will be monitored.
Great. And then just finally, I saw that for non-residents that are returning from a non-hotspot, they would be allowed to quarantine at their rental. Could you describe what that looks like? Does that mean that they would be required to stay in their hotel room? Would they be allowed to be outside of their hotel room as long as they stay within the hotel?
Yeah. So the key part here is to understand who are these non-residents who will be coming to Guam at this time when we technically have not really opened to leisure travel to Guam, and that these are persons who may be here for a variety of reasons, and they may be here for work, or they may be here because they're here for a hardship of some sort of emergency, and so all those are taken into consideration. And if they are in a hotel, and let's say they are here for a contract that's essential to the operations of Guam, that they will be on a restriction of motion monitoring, that yes, they would have to be at their quarantine at their hotel if they're staying at a hotel, but then they will be allowed to go to their place of work or place of business that they need to conduct their essential work and then return back. And then that check-in will occur with from public health in that manner.
All right, thank you, sir. I'll pass it on.
Guam Daily Post, John O'Connor.
Right. Thank you, Dr. Cabrera. I know you did touch on this a little bit, but there have been some suggestions about testing at the airport. I'm wondering if you can talk about testing at the airport and why or why not that could be an alternative to having to mandate quarantine.
Yeah, so that's a great question, and that's still something that we're still looking. But testing at the airport itself is, again, we have to remember that when we take a test, it's a snapshot. It's a snapshot in time of that person's status of whether or not they're having not just the virus, but are they actually having enough of the virus that we can pick it up on the test. And so if we just do it when they arrive at the airport, you're going to miss a significant amount of those who may be actually bringing it onto the island. So the timing is very critical in terms of doing this. And so there are different suggestions and different proposals. We'll do it, for example, in the CNMI, as they have it right now, that it's a mandatory quarantine for at least 5 days, and then you're tested at the 5-day mark. And there's a reason why the 5-day mark is chosen as in that situation to do so. Now it's still debated about that day and whether or not that's an effective means. and that's per community to determine whether that is. For us here on Guam, the amount of tests that will have to be done and to be done in that fashion will be very, very difficult. And right now it's unclear if the benefit outweighs the risk in doing so. So that's why we haven't taken that actual plan and hello. Yeah,
I'm sorry,
that's why we
I
haven't
couldn't hear
taken
you.
that plan and move forward with that overall. But I think, sorry. So actually, that's a good. Your question actually reminds me also of another point that we'll be doing. So one of the things that we want to do for in the next few weeks for these travelers that are coming from the hot spots that are quarantining is that we are going to actually offer testing to them. And so now this is targeted testing. It's voluntary because we're not going to force anybody to take a test at this point, but it is voluntary in that we are going to offer them, and it's going to be we have yet to determine the actual optimal date for that test. And with that, we'll actually be able to study and see if these requirements that we're actually putting in place right now, do they actually make sense? Does it actually corroborate? Are we going to are we actually going to see more that we're going to test in within the quarantine facility? Because right now, we're mostly just testing based on symptom development, but we want to be able to test asymptomatic within the quarantine. So with that understanding, I think we'll be better able to develop our own thoughts and requirements for doing tests post arrival if it makes the most sense for us, especially if we once we open up tourism travel.
Thank you, doctor. It sounds like our capacity to test is also a factor in any of these decisions.
Yes.
Are we having issues with capacity when it comes to doing these things, when it comes to testing at the airport or doing
Yeah.
the changes that you're describing?
It will become a capacity issue if we were to take that route, and we want to be able to still test enough so that we're doing proper surveillance here on the island and monitoring, and then also still have enough if we were to all of a sudden be hit with an unexpected wave. So those are our main priority for testing. But if you start opening it up to the travelers and in what fashion, then you kind of have to commit to that to a certain extent. And would that actually drain on what are our earlier priorities? So that's the balance that we're trying to really get a better feel for and understanding before we make more decisions moving forward based on that.
How much more do we have to increase our capacity in order to accommodate both, having to
Yeah, that's a
meet
great
our
question. And what's really going to depend on that actually is how many of the travelers are going to be coming on island and how many do we expect. I believe with Philippine Airlines over the next few weeks, we're looking at potentially 1,600 travelers coming onto Guam. Now, as I understand, it's not. We don't know how many of them are actually terminating on Guam. They may just be transiting on their way, to Hawaii or what have you. So that is a question. So it's still going to be a large number. So I really don't have a good answer for that because we have to see what are the expected arrivals that will go with that.
And you said there may be talk about testing or targeted testing for people in quarantine. Can you expand a little bit about testing in quarantine? What are the
Yes.
pros and cons, and whether we'll be able to expand that testing to everyone who has to go through quarantine?
Yeah,
at
and
some
so
point?
and that's we have yet to determine the actual approach, and ultimately be public health be leading this process here, because this will be very specifically asymptomatic testing for those in quarantine. And I think probably the optimal day for someone to test positive, if let's say they didn't have symptoms and they only got the virus right before they left their point of origin, or they caught it on the flight. Then that's anywhere between the fourth and sixth day where you're going to catch the most. But that continues over, and if you want to catch about 95% of those who may be actually positive, then you're going to have to start testing at least up to the 9th day. So those are things that we're trying to still figure out which day is optimal when to do, and we may be doing a variety of them, and then seeing how that pans out. So that's the details of how we're going to likely roll that out. and then based on the results that we have, and if they're promising, and if it looks like maybe this is something that we could relook at the option of testing out of quarantine, that may be something that we will consider as well. And so as a, for example, that's what the CNMI is doing right now. They do the 5-day quarantine, and then if you test negative, then you test out of quarantine and you don't have to complete the 14-day. But we have to do what's responsible right now, and what's going to be the safest for our community. And we think that this is a good trade-off for now, as the situation is, to fall back on the 14-day quarantine to protect our community the best we can. But it's not my expectation that that's going to continue for a very long time. But it is our best weapon right now.
I'm wondering if we also have to increase our capacity to do the testing out of quarantine if we do pursue that initiative.
Yeah, that's going to be a big part of it, I would think.
Just two more questions. Since it's not guaranteed that someone will follow directives for home quarantine, why offer that at all? Why not just require everyone be mandated to go into the quarantine facilities?
We at this point right now, we have to remember the limited resources that we do have, and life is going to continue to go on here on Guam, and we want to provide the as much of a balance as we can in terms of, again, cost versus benefit. And because the cases are low right now, and because we're allowing home quarantine from people who have traveled to non-hotspot areas, we think that the risk overall of them actually bringing is low to begin with, and we're assuring that risk is mitigated by at least by asking them at the very minimum to complete the 14-day quarantine, and so the risk already is fairly low. The risk of their non-compliance is there, and it's higher than a quarantine facility. But we think that that's a good enough balance. It's not going to be zero. We're not going to get the risk down to zero. We're just never going to be able to do that. But what risk are we willing to accept as a government, as a community, as a society to ensure that we can accommodate the livelihoods that everyone wants to get back to.
Right, and it may have been said that we are not technically open to leisure travel. I'm just wondering if that's for Guam residents coming from hotspots or to anyone.
Right now, it's again, leisure travel being tourist travel, right? So those that are coming to Guam for tourist purposes. Now, technically, you could come to Guam, for tourist purposes if you're willing to go to the full 14-day quarantine. But we don't think that that's going to be a market for that, relatively speaking. But so I think that's where we were looking at it from that approach.
Right. Thank you, Doctor.
Thank you.
Thanks, John. Mariana's Business Journal. Maureen Maritita.
Good afternoon, Dr. Cabrera.
Good afternoon.
So to get straight to my questions, how confident are you in the airlines that fly into Guam? We have heard that on those flights, there is not complete social distancing, nor are all passengers required to wear masks. So if you don't have that assurance from the airline, you have to wonder, with that link in the chain being broken, how essential is quarantine? Yeah.
So there's two ways I can answer that question, and that's a really great question. Especially that now we actually have some data that goes with that to help, instead of us just thinking about the perceived risk of catching COVID while traveling on an airplane. So number one is, so again, there's two parts. Do you have COVID before you get on board, and will you catch COVID while you're on the flight? And so there's actually a study that's actually about to be published in the Lancet that actually looked at about 130,000 travelers possible travelers, and they sampled over 4,000 of those travelers and tested them. Out of that 4,000, about 160 actually turned out positive. And out of the 160, they did a lot of contact tracing through that, and they in the finding out that vast majority of them caught COVID, coronavirus, prior to boarding to that contact tracing. And so basically out of that 100 and I think I have it here, 161 positives, only 2 of them can they actually determine actually caught the virus on the flight. So you're talking about 2 out of over 4,000 people that were tested turned up positive. So what does that say overall? Is that actually says that the risk of actually of catching coronavirus during a flight is much less than the perceived risk of it. And that's with just very basic mitigating factors on a plane, not necessarily even social distancing. It's the airflow of the plane itself. It's always from top to down, and the vent goes down. So that's actually very helpful overall. People wearing masks, that's extremely helpful overall. And of course, with regular hand hygiene, that's very helpful overall. So those really reduce the risk. And in these cases, this was all from travel during March of this year. So people were already taking precautions during those flights. And so that's actually very reassuring for us. It's an important study. I look forward to its actual publication. It's not technically right now, it's not peer reviewed. And so we'll see what the final outcome of that. But if that actually is very true, it's encouraging, and we can feel more confident in traveling overall. And so it's an optimistic view, I think, overall.
Right, thank you. Well, I do know the Lancet has an excellent reputation.
Yeah, they do. They did have one recent, snafu that they retracted, but then overall their history is one of the best.
Yes, going back centuries. Anyway, so the people that are exempt when they arrive in Guam, they're federal, military, mission essential personnel like FEMA. So are they completely test-free when they arrive on island, or have they had a test somewhere along the way?
And so they will fall under the non-resident travelers, and we're assuming they're traveling from domestically or from a non-hotspot international location. And so they will fall under that. If for them, they'll be under the restriction of motion, and if they want to be in their regular quarantine, then they in their regular hotel or rental lodging, what have you, then they would have to have that test prior to coming that shows a negative result within 1 week. So they fall into that category overall, and they would still have the restriction of motion, so they can go about do their work with the right precautions, but they have to come back to their facility or their lodging.
Okay, but they would still be able to work, right? And they would
Correct.
still be tested. Okay.
Correct.
Right. Okay. So in assuming that we continue on the present track, we're going to have some form of open tourism, where presumably we're not going to have a test that is going to require people to quarantine because they're only coming for like 3-4 days. So what are we going to do about residents at that point?
Yeah. And so, in order for us to be at a state where we can actually do that, quarantine has to be looked at in a very, very different way. And are we going to get to the point where we're comfortable with this, very, very shortened quarantine period? Maybe it's an extremely relaxed quarantine type of scenario. So that's really what's going to have to take. But we have to be assured from our data, and as we list these hotspots, and as we determine them, the tourists that come from non-hotspots are going to be the main ones that we would even allow to give this more relaxed regulation overall, so that the risk doesn't increase, in terms of spread, and they may be able to come here to Guam for that 3 days, and maybe we go back to thinking about them having a test before they travel, or being tested while they're here, and at least that can. It's not going to be perfect, but I think it will definitely reduce the risk of spread, and we'll have to get to the point where we're comfortable with that balance.
Okay, and lastly, I just wanted to talk about some of the clusters that we've had here, versus people coming in from hotspots, because really my understanding is that those two clusters that we've had that have been well spoken about, right? One from the religious community and the other in Jigo. There didn't seem to be a huge spread, right? And yet these
Yes.
are presumably people that were going out and about on the island, at least to some extent, shopping and what have you, meeting other people. So, so again, why are we so hard on people who are coming in to visit or returning residents when even people from these large clusters, we haven't seen a spread of hundreds of people?
Yeah. And that's a very good question, and there is no perfect answer to that question, but I think it is very clear that, that we could potentially have our hands full with the virus that's already on the island. And when you're introducing a unknown factor that we don't check in any way in terms of mitigating the risk, then you're just really, could potentially adding fuel onto the fire. So in this situation, with where we actually are seeing that these somewhat clusters are not spreading out in a way that's more that's concerning to us, of it being uncontrolled, then you're right. I think that we should have tremendous comfort in that finding, and that's an important finding overall. It means that our efforts are working. It means that what we're doing, what the community is doing, is really working, and it's showing that it's effective. The key thing is that we also have to show that um, that we're doing this consistently, in order to be an attractive place for people to come here and not be worried about catching COVID here on Guam and then taking it back to South Korea or Japan, for example. But in terms of the concern for the persons coming in from the States, I think it's, every positive is something that needs to be contact traced and isolated, because and so we don't take them any different. And what's good to know is that these positives that we've had from people who are traveling, they turned out positive while in quarantine, which emphasizes that quarantine works, and that we want to be able to catch them during that time period. So it's a matter again of what we're willing to accept in terms of risk.
Okay, nothing more at this time. Thank you, Doctor.
Thank you.
Thank you, Maureen. Pacific Island Times, Johanna Salinas.
Half a day, Dr. Cabrera.
Have a good day, Joanna.
Hi. So my question is about those that are residents and they're supposed to be quarantined in the hotel, or like maybe quarantined at home. Sorry, yes, those quarantined at home. So, what happens to those that are supposed to be at home, but they don't follow through with the guidelines? Because I saw on one of the government workers' Facebook page, one of those government workers who works at the hotel, she saw someone who was supposed to be quarantined at home, but then they ended up just going out around the island, going to the beach.
Mhm. Well, I think it's clear in what's published is that they are subject to penalty, and it's as I understand it, 100,000. I mean, sorry, a $1,000 fine that goes with that. Now, as we know in Hawaii, they enforce that fine, and they actually ticket these individuals, and so I think it's all case by case, and I think it's we reserve that right to impose that fine on them. And so in this situation, which I'm not familiar with, that you're mentioning, and if it is true, then that person, you should be concerned about the potential, because they're putting the entire island at risk when they do such when if they don't comply.
Okay. So, how will this be enforced? Like, who will monitor those in quarantine?
So that's public health's job overall, and so you have to understand that those that their monitoring of those in quarantine is a spin-off, so to speak, of contact tracing, and that they use similar resources in order to do that in as efficient way as they can. The process is there are minimum expectations of how often you're going to be checked in on, but the main point of that is that it's randomized, and so you don't know when that might be and in what fashion that might be. Is it just going to be a phone call, or are they going to show up on your doorstep, which they do that. And there have been instances where they've found people non-compliant after showing up at their door. So that's something that that's part of the enforcement.
Okay. Okay. So my next question is about the essential workers who are gonna just stay quarantined in their own rental, but then they're still able to go to work. Okay, so those essential workers, are they only allowed to go to their work and their rental? Are they allowed to maybe go to the mall or go out to eat,
No,
like at a
not at all.
restaurant?
Not at all. They will not be required. I mean, they will be required to strictly go perform their duties and then return to their quarantine area, which may be their rental lodging.
And public health will monitor them too.
Yeah, so they have a system for that also, and that they have to report when they I believe the times of when they've left and when they've returned.
Okay, thank you so much.
You're welcome.
Thank you, Johanna. Nestor, did you have more questions?
I think Dr. Cabrera's covered most of it. I just have one more. So given the number of arrivals we are anticipating from the Philippines once Philippine Airlines starts back up, do we have adequate government quarantine facilities? And given the previous flack, are all the contracts in place?
Yeah, I won't be able to comment on that specifically, as that's not my lane. But the request was made, and so my understanding is that they have been working to ensure that, and I have confidence that they will be able to provide that.
Thank you. That's all I have.
Okay.
Thank you, Nestor. And any more questions from our media?
I have one.
Sure, go ahead, Maureen.
Hi again, Doctor. So this is from one of our readers who is listening to you, and he says, based on what you said, if a country like Palau gets one case, they have no cases now, then they get 2 cases 15 days later. Are they considered high risk? He says that doesn't make sense when they are a clean country.
Yeah, so that's a very good question. And so everything's in context, right? And so
Yeah.
one of the things that we put there specifically in the language of how we define a hotspot is that that we take that number into advisement, and so that it's not a full set part, in that ultimately public health has will make the final determination of what are the areas that we're going to be determining as a hotspot. And that's based on the advisement of the physician advisory group as well, and the state surgeon. So we will use that data that we get from in that situation. But let's face it, if we see that that's if all of a sudden it starts rising within Palau, then that's something that we have to be concerned about, and then we would have to get more information from Palau and see if that actually poses a risk to Guam in some manner. So in a smaller situation like that, where you have to be sensitive to the nuances of the small sample size overall, we will have to take that into consideration overall. And it may be that we will exempt it from this actual determination.
Okay. And lastly, when are we going to hear about the final arrangements for tourists? I mean, so that we can all know what to expect, most especially those whose living depends on it.
Well, I think this is what we're doing here in terms of this of preparing and dealing with the influx of international arrivals. This is a major stepping stone for us to better be able to define what's going to take to safely reopen to tourism, and in what fashion and in what way are we going to mitigate those risks. So we're putting these regulations in a way that protects us the best, but also allows us to study it the best. and then with the information we get from that, we'll hopefully come up with very good information. And so I anticipate that's going to develop over the next couple of weeks.
So within 2 weeks, you think?
I would say so.
Okay, thank you.
Thank you, Maureen.
That's it.
John, I see your mic is hot. Do you have any
Right,
questions?
It's,
As long as it's not a
it
hot
is related to the
spot.
hotspot.
Sorry, I see your mic is on.
Right. It is related to the hotspots. I see we have the New York Times map, but will GovGuam be publishing a list of hotspots on its agency websites, and if so, when?
Yeah, we've asked for public health to find a way to include it into their dashboard, and then also will be part of the JIC reports as well. And then it will be updated probably no more than every no less frequent than every week, but probably it's going to be more frequent than that is my estimation, probably every several days.
Do you know how far along public health is in generating that list of hotspot countries?
I don't, but really what the key part here is understanding which are the ones that are arriving here on Guam and if as they are listed. So in the slides that were presented, and I believe will be shared with everyone in the media, that really there's only one right now in terms of those that are originating, and that's Philippines.
Thank you.
Okay.
Thanks, John. Anybody else? Any more questions? Okay. If there are no more questions, I guess that's it. Dr. Cabrera, any
All right.
other remarks?
That's it.
Okay.
All right. Thanks, everyone.
Thank you, everybody.